I bring in all the greetings and wishes from Speed Medical Institute on behalf of all the faculty members of Speed and management of
Uh,
Speed to Dr. Athul Francis, who has got a great rank of 19 in DM Respiratory Medicine or Pulmonology group in Neet SS 2022. Congratulations to you. Wish to to you.
Thanks a lot.
Great, doctor. And can you brief us, background history from where you started?
So basically, I did my MBBS from Padamala Medical College, Mangalore, and I'm 2010 batch of MBBS. I did my PG in respiratory medicine from BJMC Pune, and I completed my PG in 2020. And
Okay.
after that, I had a government bond of 1 year in a district hospital there, which
Okay.
I completed in 2021. And I
Okay.
had been working in a private setup for the past 1 year. So this is my second NEET DM entrance.
Great. And your aspiration to do a DM pulmonology, you have started before you joined the PG as well?
No, sir. It wasn't. It was never in my mind. So when I joined respiratory medicine, I joined respiratory medicine thinking it's an end branch. Then
It's an end specialty.
yeah, end specialty kind of. So then I joined the branch. Then later and later, as I mean, when I started knowing the subject a bit more, I mean, more and more, when you read more and more, I mean, you come to know that more and more interventions are happening in the field, and there are more subspecialties which are developing inside respiratory medicine. So that is when I thought a higher study is necessary. So that is why I attempted to be a mentor.
Great. So we started, and how do you started, and what are your preparation strategies, and how you did it? How much time you spent for this?
All right, sir. So basically, as I told, I have been working from 2021 in a private hospital, and I'm a single consultant here. So I used to study whatever little bits of time I used to find in between my OPDs or after my job hours, which was around after 6 o'clock. And mainly I used to follow whatever was there in the speed videos and in the speed the notes which were there. So because I was in OPD and there was in time that I could stream the videos. So most of the time I used to read notes by Saurabh Ahuja sir and Hariharan Iyer sir. And many a times since the live classes were at after 7 o'clock or around 8 p.m. So I used to attend some of the live sessions as well. But more of it was reading the notes which were there and keeping on recollecting and keeping on updating. Because I never saw it just from an entrance point of view. Even from my practice point of view, it was something which was very, very useful because it was something which was all updated. As many people have already told, our textbooks, Fishman last edition came out some time ago, I think around in 2015 or 16. So guidelines were in that updated. But the classes which were taken by both of them were really, really helpful. Helpful in for understanding the subject more and even in my clinical practice as well. So that also was one of the main reasons which made me understand the videos, because when I was going through the videos, I understood there was a lot of things which were left to learn in respiratory medicine even after MD. So my preparation strategy was read at whatever time, little time that is available. But that helped, I guess. And the fact that maybe I looked it from a clinician, and even this year the questions were more of a clinically oriented questions. So that also helped because it was something which we used to regularly do in OPDs, like which is the first investigation of choice. So kind of that also helped helped a long deal. I mean a great deal actually.
Great, doctor. Wonderful. And I really appreciate how you looked at your preparation. It's not just a preparation, it's a wholesome. That means it will be useful for anyway. I'm in that field and I will use that knowledge for any purpose.
Even if I don't get an entrance, it will be useful in my clinical practice anyway. So that's the only way I was thinking about it.
Very nice. Very nice. So now where are you planning to take up the seat?
So I'm basically looking for somewhere where there is no bond and something of that sort. So I'll be keeping my option. It will be difficult to get in colleges in Delhi and stuff because the seats are few. So I'm keeping my options open and inquiring as well others how to get a good seat. So depending on that, nothing has been fixed as of now. So, but just going through the motions, whatever is there.
Great, doctor. Once again, I bring in wishes and greetings to you. and from Speed, and wish you a great career in pulmonology, field of pulmonology and DM super specialty. And definitely your dedication, the amount of dedication which I could sense and I could feel from you, definitely more patients will be benefited out of your services. And department will also get a lot of contribution from your services. And for all that, advance wishes and congratulations to you.
All right. Thank you, sir.
Thank you.